Chairman Hennessey for questions.
Thank you, Mr. Chairman, and good morning, Secretary Osborne.
Good morning.
Mr. Steadman, Mr. Gingrich. The Community Health Choices Program is a new program being jointly rolled out across the Commonwealth, jointly between the Department of Human Services and Department of Aging. And basically, it's going to administer long-term care services for the elderly and the disabled once it's fully rolled out and fully implemented. This will be a major shift for how services for seniors are managed, and it could be very complicated for our seniors. Can you tell us what the Department of Aging and the Department of Human Services are doing collectively to ensure the smooth transition for our seniors who must change from an aging waiver status to a new managed care organization, and will they still be able to provide or to pick and choose the providers for the services that they need?
Sure. Indeed, it was just a year ago when Governor Wolf talked about his senior plan. Part of that senior plan had two particular pillars. One was to ensure that we advocate on behalf of older Pennsylvanians so that they can access home and community-based services and they can age in place in their communities with the dignity and respect they deserve. The second pillar, which wasn't part of your question, but just so that it's well known, is prevention in order to ensure, and protection in order to ensure that we protect vulnerable individuals, especially our seniors, from all forms of abuse and neglect. To the direct point of your particular question on community health choices, as we look at our current aging waiver program, because that's the program that serves most older Pennsylvanians who are clinically eligible for nursing facility level of care and financially eligible for medical assistance. So as we move from a fee-for-service model to a managed care model, there are particular roles that we play at the Department of Aging. I said in my opening statement that we are the state unit on aging, required and responsible to do many things. Part of our role within a community health choices environment is that we advocate on behalf of older Pennsylvanians and that we ensure that any program or service from any department within the Commonwealth, and in this instance it's the Department of Human Services as our partner, that program is going to positively impact the life of older Pennsylvanians, not negatively or adversely affect that life. So our role is to ensure that as the program is designed, as we move forward to implementation, that is a seamless transition for seniors. One of my greatest concerns, and those who I work with most closely at the State Unit on Aging, as well as at the Department of Human Services, which is the state Medicaid agency, is to ensure that we educate folks. That's the older seniors who need to engage in this program, their family members who help them make decisions. And as you look at the plethora of points where there are touchstones into the lives of older Pennsylvanians, my mom, for example, just ended up in the hospital right before Christmas. Because of the position I hold, I know a thing or two about the aging system, but that was a time for me to watch it work or watch it not work with regard to hospital social workers, home health care agency social workers, anything that we could possibly think of who we have to educate so that we ensure that the program is understood, that folks know where to go for help, and that we don't lose folks along the way. So we do anticipate a seamless transition from individuals who are currently enrolled in an aging waiver program into community health choices. With the rollout and working with managed care organizations who will be successful bidders with regard to the request for proposal that it will be released in the next couple of weeks, I imagine, that they have an opportunity for choice within their particular region. So we are ensuring that there is still choice of providers of MCOs. And with our network of VARI agencies on aging that are so dedicated and so in tune to needs in their particular community, that provider base, the local provider base, is going to be critically important to us as a Commonwealth and to the managed care organizations that we will be working with to ensure that providers can continue to have the resources that they need. And by that, I particularly mean direct care workers. How could we possibly engage in a program that's going to ensure that older adults can age in place if we don't have a direct care worker pool that's capable and competent in order to render them appropriate care? So they are all of the various moving points and moving parts that we are working on to ensure that there is a seamless transition into community health choices from a fee-for-service model to a managed care model.
Okay. Thank you, and I'm glad that your mother's situation resolved itself so smoothly. And our concern is always that it's going to be replicated every time we have a senior in that kind of situation. And, you know, there are inevitably going to be glitches. We just want to keep them to an absolute minimum. Of the 450,000 estimated people who are going to be dual eligible for Medicaid and Medicare services, can you tell us what percentage are over 65 as an estimate? Give us a thumbnail, if you would, to let us know for planning
Sure.
what that percentage might be. And then for those who are between 60 and 65, so that they would qualify for Medicaid but not yet Medicare, how are they going to be handled? Are they going to be continuing under the aging waiver program, or are they going to still be into an MCO and have to somehow fit in?
Sure. A couple of different parts to your question.
Right.
I'll try to capture them all. With regard to the pool, of the approximately 450,000 individuals that we anticipate to be serving in Community Health Choices, approximately 130,000 of them are folks either over 60 or under 60 that are currently engaged in a waiver program. The number or percentage of folks that are over 60 would be roughly
It's about two-thirds.
about two-thirds of those folks
Thirds of the 140,000?
that are specifically over the age of 60, correct, currently active in an aging waiver program.
Okay.
So in order to participate, as you indicated, the individuals in the program would be dually eligible, meaning they are eligible for Medicare and eligible for medical assistance and clinically eligible for nursing facility level of care services.
Okay. Now, the second part of my question was those age 60 to 65, not qualified for Medicare because they haven't reached 65 yet. How are they going to be handled? Right now, they're under the PDA waiver
Correct.
program, but how are we going to transition them into an MCO, and how smoothly is that going to operate?
If they're currently engaged in the waiver program, they would be rolled into Community Health Choices.
Okay. When you say they will be enrolled, do they have a choice, do seniors and anybody on disability, do they have a choice as to which MCO they go to?
We anticipate that in the regions when rollout occurs, that individuals will have a choice between 2 to 5 managed care organizations in their particular region.
And a large part of that will be dictated by whether or not their particular service providers, who they have grown to know and trust over the years, as they've participated in the waiver program, might or might not be on the list of providers that the MCOs have chosen.
That is a correct point and an area of concern that we share, and that is why since June 1st of last year, when the first concept paper on Community Health Choices was rolled out, we, between the Department of Aging, the Department of Human Services, and our stakeholders, have been ensuring that managed care organizations are introduced to provider groups across the Commonwealth, because, as I mentioned a few moments ago, all things are local with our local area agencies on aging that have a tremendous provider network already in place. We need to ensure that providers are up to speed on what this program is, what it means for their scope of business, and to ensure that they're prepared for this new program within our Commonwealth.
Okay. Switching gears on you, excuse me, if I can, the AAAs, we're very proud of the system of area agencies on aging, the AAAs, across our Commonwealth, and yet repeatedly in this administration, even in prior administrations, they have been, it seemed to me, limited at times in terms of the services that they can provide. I understand that they've been chosen to be the level of service coordinators, or I'm sorry, not the coordinators, the assessors for the proper level of service that a person might need and qualify for. But tell me, is there anything else that we can do? Since over the years, they've developed relationships with our elderly, and if we simply eliminate them from providing some of those services as we go forward under this new Community Health Choices program, how do we keep them vibrant? How do we keep them financially solvent so that they're there to do the level of assessment functions, but also any other services that our elderly might need?
Sure. I selfishly appreciate that question because I come from the Area Agency on Aging Network, having served as an Area Agency on Aging Administrator both in Lackawanna County as well as in Luzerne, Wyoming counties. Some would say that I am biased when it comes to the role of the Area Agency on Aging in any program or service within the Commonwealth. I smile as I say that because that's probably somewhat true. With regard to the Area Agency on Aging, their role is incredibly important and incredibly valued and very much needed and necessary. And without it, I firmly believe a program such as Community Health Choices would fail. What do I mean by that? Our area agencies on aging have the pulse of the local community at their fingertips. There are 67 counties in our Commonwealth, as we all know. There's 52 local area agencies on aging that serve the needs of individuals within their particular planning and service area. Coming from the county I come from in the Northeast, I could speak pretty well to the needs of older Pennsylvanians in my particular area, but how do I do that for Philadelphia, for Erie, for Washington, and so on and so forth? I need and rely very heavily upon our area agency on aging administrators, as well as their membership organization, the Pennsylvania Association of Area Agencies on Aging, in order to ensure that older Pennsylvanians have access to home and community-based services, whether we are providing it directly or whether it's being provided from a sister agencies such as the Department of Human Services, or even when it comes to nursing home care, they are licensed by the Department of Health. But it is incredibly, incredibly important that our area agencies on aging are aware of and tuned to, prepared for, and responsible to ensure that we advocate always on behalf of the older Pennsylvanians who we are called to serve. So that role is incredibly important. I also appreciate that you mentioned the role of the clinical eligibility determination. That is a function that the area agencies on aging have provided for many, many years in the Commonwealth of Pennsylvania, and a function that they are quite apt at performing, and a function that they realize that where there are concerns, that they are poised and ready to respond to those concerns so that we ensure that older adults who require these services have access to them, and that we are providing them a sound quality of life.
Okay. Thank you. Your concern for the AAAs is mirrored by my own. I think that they provide a tremendous service to all of our elderly across the Commonwealth. And some of the recent decisions in this administration and prior administrations have sort of cut into their bottom line, and we simply don't want them to flounder. We don't want them to be so decimated by reduced incomes that they can no longer function or no longer exist. A short question, the $2 million grant program for our senior centers funded from our lottery proceeds has been a great success under the Corbett administration. I see that it's being proposed to be continued under this administration, the Wolf administration. Can you tell us where the status is for the grant proposals? Senior centers, people who might be watching on PCN should understand that the senior centers have to set out in detail the kind of programs and projects that they want to have funded by this proposal. And then the Department of Aging and whoever else considers them and authorizes grants in certain various amounts. But we have the $2 million there. When can we tell the senior centers that they can get ready and actually file a grant proposal?
Sure. That's a great question, and one that's on the lips of many who have asked about them. Just for a little bit of background, in the last two fiscal years, 13-14 and 14-15, to be certain, $2 million was made available in senior community center grants across the 67 counties of our Commonwealth. Those grants that were rendered prior to my being here, obviously I was concerned about them, not just that they happened, but were they effective? So one of the opportunities that we have right now is to ensure that we are reviewing those grants that have already been allocated to ensure that they met the goals that they said they were going to meet when the grant was awarded. So we are in the process right now of reviewing those assessments in concert with Temple University, who's doing the review for us. Moving forward into 15-16's budget, another year when those $2 million in services to senior center grants were made available as a competitive grant process. With regard to releasing those grants, I'm told that typically the Department of Aging had released those grants sometime in February. Well, we sit here sometime in February, closer to the end rather than to the beginning, and they haven't been released yet. I want to give a little bit of context as to why that is. With regard to December and the emergency spending plan that was put into place, it resulted, and I'm grateful for it, it resulted in 7 months worth of payments being issued to the network of area agencies on aging within about a 4-week period of time from mid-December to mid-January. That was over 1,600 payments, $300 million released to those 52 area agencies on aging in a very short period of time. The last thing that we wanted to do, the last thing that I wanted to do was then to say, hey, by the way, guys, here's a competitive grant process that you can engage in and get us your applications back in a timely fashion so we can review them and allocate funds. So we delayed purposefully the release of the 15-16 grants. We are poised and positioned, however, to work with the Aging Network and those who operate senior centers. As an aside, under the Older Americans Act, we're required to have one senior center in each planning and service area. In our Commonwealth, we far exceed that, not just because of the good work of the area agencies on aging at the local level, but many nonprofit senior centers that function in counties across this Commonwealth. We have over 530 senior centers in our Commonwealth, not all of whom rely upon the public dollar. But we have an opportunity with these senior community center grants in order to help us prepare them for the future, whether it's a renovation or new programs or a startup or a reconsolidation in a particular area. So we are proud of the work that's been done, grateful for the support of it, and we'll continue to work with our area agencies on aging to release those grants to the point of your question, Mr. Chairman, in April of this year.
Okay. That's to release the grants that have already been applied for. When will you be starting to receive new applications for new grants?
We'll release the application process in April 1st. And that would then give time to the area agency on aging. That will open it, yes.
Okay. One final question and a short one. Representative Chris Ross's House Bill 1702 became Act 166 of 2014, would authorize community respite centers across the Commonwealth. Can you tell us where we are in terms, as a Commonwealth, in terms of getting those created and available to families of seniors who just need to get a break for a day or an hour or whatever?
Sure.
You know.
Support to our caregivers is obviously incredibly important, and the Pennsylvania Community Adult Respite Services Program was passed. Immediately, we started working with stakeholder groups as well as leadership within our department in order to ensure that we have regulations that are in place, that are in concert with our already existing adult daycare centers, but moreover, ensure that we can serve that vulnerable population in the community where they desire to be served and provide that much-needed respite to caregivers. So that is being worked on within a very specific timetable of when we have to come back with a aging program directive, and a revised timeline gets us to, when is that?
We are working with the stakeholder group and meeting monthly with representatives of the association in hopes of having something that'll be publicly disseminated this fall.
This fall. Okay, so there's no preliminary lists out there now. It's just, or any kind of information that might be available to seniors or their families across the Commonwealth now, but it might be available come fall?
Some information was published in the Pennsylvania Bulletin in the last fall related to information for entities that are interested in offering the service, because there were provisions within the Act that allowed for existing licensed centers to offer this service. So that information is available, and we've gotten a few inquiries on that. So we do have a couple of facilities that are operating this type of program.
Okay. And is that available on the Department of Aging website, that information?
Not yet. Not yet. That specific information isn't necessarily on our website yet, but if folks are interested in it, they could certainly contact us and we'll make it available to them.
Okay.
As we work through the stakeholder process, we certainly will ensure that folks are aware of what this new program is, how to access it, and how it's going to help improve the quality of their lives.
Okay. Madam Secretary, thank you very much for your testimony.
Thank you.
Guys.
Thank you.